Brandi and I'm a nurse practitioner student at Auburn University. And today we're going to be going over Tricyclic Antidepressants, aka TCAs. First off, the action of TCAs. They block brain cell communication of norepinephrine and serotonin to help relieve depression, aka the use is depression. Medications of TCAs are amitriptyline, doxepin, nortriptyline, imipramine, protriptyline, and amoxicillin. Pharmacodynamics. They ease depression by impacting chemical messengers used to communicate between brain cells. TCAs work by ultimately affecting changes in brain chemistry and communication in brain nerve cells known to regulate mood to help relieve the depression. Pharmacokinetics. TCAs are absorbed completely when taken orally, but undergo first-pass effect. With the first-pass effect, a drug passes from the GI tract to the liver, where it's partially metabolized before entering circulation. TCAs are metabolized extensively in the liver and excreted in the urine as inactive compounds. The extreme fat solubility of these drugs accounts for their wide distribution throughout the body, slow excretion, and long half-lives of 6 to 18 hours. Pharmacotherapeutics. Precautions. History of suicidal ideations and behaviors, hyperthyroidism, heart, renal, and hepatic disease, urinary retention, which is BPH, and history of seizures. Contraindications. Acute recovery phase of severe CDA or than 14 days of taking an MAOI. Advanced drug reactions. Seizures, insomnia, anxiety, irregular heartbeat, hypertension, urinary retention, and sexual dysfunction. Drug interactions are amphetamines and sympathometics. They cause hypertension. Barbiturates increase metabolism, which in turn decreases level of the medication. And cimetidine impairs metabolism, which is the risk of toxicity. Rationale drug selection. Before prescribing, NPs need to obtain a patient and family history of suicide and cardiovascular disease, as these are risk factors for adverse events. Avoid using these drugs in the elderly and use with caution in children. Monitoring. You need to get a baseline EKG, vital signs regularly for hypotension or tachycardia, observe for mood changes, benefits, may take a few weeks to kick in, monitor for adverse reactions that were listed above. Patient education. Know the risks and benefits of therapy and that the therapeutic effects may take a few weeks. Take exactly as prescribed. Do not increase, stop, or take another drug such as over-the-counter or herbal supplements without medical approval. Overdose is commonly fatal. Store in a safe place. Avoid alcohol. Avoid hazardous equipment that requires mental alertness. Monitor blood glucose levels. Excessive exposure to sunlight, heat lamps, and tanning may cause burns and abnormal hyperpigmentation. You can use sugarless, gum, or hard candy to relieve the dry mouth. Report adverse reactions promptly. Main takeaways. They are named tricyclic because they have 3 rings in the chemical structure. When a depressed patient begins to feel better, the risk of suicide increases, so monitor your patient. Benefits will not peak for several weeks, so make sure to give it a little time to kick in. Therapy usually continues for a minimum of 6 months. Do not abruptly stop taking the medication or a relapse can occur. Death occurs with overdose of a 1-week supply. So, in closing, ladies and gentlemen, get on the Tricyclic and ride!